My name is Smita Guba. I'm the head of Department of Medicine, but basically I do a lot of research in medicine and in people, in populations, in societies.
During COVID-19, we need to ensure that we can help the vulnerable in many targeted ways. And why focus on elderly people? That's because in Mauritius they have a lot of chronic diseases like diabetes and hypertension. So this makes them even more susceptible to complications. But in addition to this, we know that elderly people live alone and they have less social support and therefore they live in more fragile circumstances.
I'm Sandhya Ganes. I work at the University of Mauritius. I'm at the Center for Innovative and Lifelong Learning. The idea for this project emerged mainly because worldwide casualties recorded indicated that the elderly were most at risk to this health pandemic, and we could apply geospatial technology to enhance preparedness in the future. The specific objectives for this study were to conduct surveys with the elderly to understand their concerns better, to extract social vulnerability indicators from existing census data, and to develop social vulnerability index maps for Mauritius at district, ward and village level. The findings from literature review indicated that there were 4 main health risk factors linked to COVID-19: age, gender, comorbidity and response of the immune system, thus placing the elderly, especially males, in the category of those most at risk to this health pandemic. The literature also highlights a number of social factors such as housing conditions, economic status, family support, access to basic needs that add to the vulnerability of the elderly.
Part 1 of this current study was the field surveys conducted in the villages of Chemin-Grenier and Réduit. The surveys involved the design of a questionnaire with 23 variables. The survey questions were designed to gauge the coping capacity of the elderly. It is to be noted that 44% of those surveyed found it difficult to cope with the pandemic. The results of this survey were illustrated in the form of a spider diagram, and in addition, the survey identified the main concerns of the elderly during the health pandemic. These were summarized as follows: the risk of no access to food supplies, the risk of no transport facilities to medical centers during emergency, the risk of being contaminated, and finally the risk of being left out, that is, of feeling isolated during the pandemic.
In the second part of the study, the Geospatial Technology was used to develop social vulnerability maps. First, a multivariate analysis was carried out using the field data, and from there 4 factors were highlighted: living conditions, access to basic facilities, mobility and economic conditions. This understanding was then translated to the secondary data, the census 2011, and social vulnerability indicators were extracted. A total of 14 social vulnerability indicators were extracted from the census data. These indicators were derived for all the 9 districts and for all the 144 wards, and a weightage was associated with all the indicators. The weightage varied from 0.05 to 0.15 based on the relative importance of the indicator in the context of a health pandemic. The indicators were then combined into a social vulnerability index value, and from there the map was derived for the district and for the wards. The social vulnerability map was classified based on low, medium, medium-high and high. A comparative study was carried out to highlight a key information. At district level, there can be enough facilities, but when analyzed at community level, not everybody has the means to access all facilities. Next, the geospatial analysis was carried out to develop a heat map. This heat map highlighted the priority zone within a village where resources and support could be focused. To conclude, we would highlight that the concerns of the elderly during a health pandemic are access to basic needs, access to health care, and lack of support. And the recommendation for this is for the health and the social security sectors to mainstream these concerns while developing strategies to consolidate the coping capacity of the elderly during health pandemics. The second observation from this study is that census data can effectively be used to develop SVI maps both at district and at village level. So the recommendation here is for an institution as the MOIC to promote the development and update of SPI maps to different types of hazard, as SPI maps can serve both as a working tool for concerned authorities and as an effective communication tool for the general public.
So to conclude, this project really outlines how a social vulnerability index map form part of the process of risk reduction and building resilience of communities to a particular disturbance, and in the local context, the COVID-19 pandemic.
We wish to thank all our elderly participants for helping us in this study. We wish to thank all our research assistants and all our colleagues who have helped us to complete this study successfully. We hope the results from the study will be useful to the general population and to various ministries and also to other researchers. And finally, we would like to thank our funding agency, the MOIC, for funding this project and making it possible. So thank you to you all.
MOIC has a fair share of activities concerning social innovation and social inclusion. So this project was funded under the SCP COVID-19 goal and will be instrumental to map the vulnerable groups. It would provide a tool for government and authorities to be able to help that particular section of the population.